Hi there, welcome back. The surgery's over. It all seems to have gone very, very well. I was in recovery for 2 hours. I'm back up now, just 20 minutes or so. The leg itself feels pretty okay. It's a little bit tight, as you would expect. All the work is done through two little keyholes at the front of the thigh. They pump a lot of water through the hip to wash it out. So in doing so, some of that water gets pushed into the thigh, and so the thigh gets bigger and bigger. When it feels tight, it is okay to move it. So you can simply do things like this. Okay, so bringing the hip a little bit up and down, sliding your heel along the bed. You could do it in repetitions, 10 or 15 if you want. You could do it in time, so you could spend about 30 seconds. But basically just trying to move it up and down, so you use a little bit of the hip flexion when you're doing it. It stops it seasoning up. You can also go a little bit in and out to the side. That gets up around here and into the groin area. You can tense up your quadriceps, lifting your heel like that, and you can pump your feet up and down. It's just simple movements, just to keep it moving, so it doesn't get too tense. Little and often with those. If you spend a long time doing the exercises, you'll make yourself sore. So by doing a little bit of exercise now and again, then you don't get to the point of making yourself too sore. It's okay to put weight on it when you stand up. You obviously don't put full weight on it, but it's weight bearing as comfortable. I was actually up there maybe 15 minutes ago just to test it out. So just to see how it was, you use the crutches, and the crutches are simply there to keep you steady while you're getting up. So you can put weight on straight away, sway side to side. It's also quite a good little balance exercise. I find that it works very, very well. Take a few steps on the spot so it doesn't seize up too much. And I'm probably putting about 70% pressure on the leg, and the crutches are taking the excess. So then when you use the crutches, you would be crutches, operated leg, good leg past, crutches, operated leg, good leg past, and that will just keep it steady. Well, hopefully this helps a little bit. I'm going to relax back into the bed for a while, and I might update you later on the next part. Okay, it's approximately 4 hours now since the surgery was done. It felt a little bit stiffer, so what I thought I'd do is to try out a little bit of movement in the leg. Go. The thing with the movement is just regular kind of easy movement will just help to free it up a little bit. We would usually get patients to maybe try the bike after a couple of days. What I wanted to do was try it day one, just to see how it feels, to see if it was comfortable enough to do it. It feels okay. There's no catching, there's no pain, but there is a little bit of soreness, a little bit of stiffness. With this machine, you can use your hands if you want to try and make it a bit easier on the legs, but I'm mostly using my right leg. It's doing most of the work, and the left leg's doing a little bit, but not much. As you can see, it's not coming up too high, so I'm not putting pressure on the labrum. It generally feels okay. Now, most people do find that when they do try the bike at an early stage, the most uncomfortable bit is getting on and off the bike. Really, the only way to know how it feels is later on afterwards. If it gets very sore, then it's just a little bit too much. So we'll again gauge that at the time. You want to have a little bit of resistance on it, but not much. Just enough that your legs aren't slapping around and they're not kind of going around really, really quickly, like as if it's running away from you. So we'll give this a few minutes, and I'll let you know later on whether it's sore or not.